Welcome back guys. Now in this video let's discuss about glomerular filtration. So glomerular filtration means how actually the plasma is filtering from glomerular capillaries into the Bowman's capsule, how it actually happens. Okay, that we will discuss in this video. Now in order to discuss that you need to know some important basic points about the structure of the glomerulus. Okay, how exactly the glomerulus is there. You have to know about the filtration barrier. See, fluid is moving from the glomerular capillaries into the Bowman's capsule. Okay, fluid from the glomerular capillaries have to filter down into the Bowman's capsule. It have to cross through a filtration barrier. That we will discuss now. Okay, first of all let's see the structure of the glomerulus. After that let's discuss about the glomerular filtration. Okay, now look at here. The structure which I am showing you here, this is the glomerulus where the glomerular capillaries are present. All these are the glomerular capillaries, and here is the Bowman's capsule. Here is the Bowman's capsule. Let's see in detail. Okay, now see what is the function of the nephron? Yes, glomerular filtration. We know how much is filtered. See, every minute how much is getting filtered? Sir, every minute 125 ml of plasma will be filtered. Okay, 125 ml of plasma will be filtered every minute in both the kidneys, in all the nephrons. Okay, 125 ml of plasma is filtered. So in 1 minute 125 ml of plasma is getting filtered means every day how much filtration is happening? Every day the glomerular filtration is 180 liters. Okay, don't think that you are having 180 liters of plasma. It is like, the same plasma is filtered again and again and again. Okay, so now let's discuss about the structure of the glomerulus. See, here is the afferent arteriole. See, this is the afferent arteriole. Okay, the renal artery is going to divide into branches, like the small branches, and the final branch is this afferent arteriole. Now this afferent arteriole is going to bring the plasma. Okay, this afferent arteriole, it is bringing the plasma or blood, the same thing. Okay, it is bringing the plasma. Now this plasma is going to enter into these capillaries. Now these capillaries are called as glomerular capillaries. Okay, so here filtration will happen. This is the place where filtration will happen. All the filtered fluid is going to enter into the glomerulus. Okay, the filtered fluid is going to enter into the glomerulus. Now see, 625 ml is coming. Okay, 625 ml is coming. Out of that 625 ml, only 125 ml is filtered. Out of 625, only 125 is filtered. So what about the remaining? So the remaining fluid which is not filtered, it will go back. See, it is going back via the efferent arteriole. It's going via the efferent arteriole. So afferent arteriole brings the blood. Efferent arterioles take the blood. Okay. Now see, let's discuss about the filtration barrier. So what exactly is this filtration barrier, and it is made up of which structures? In order to understand that, see, now the fluid, okay, the plasma, where exactly is the plasma present? See, plasma is present within the capillary, right? Plasma is present within the capillary. Capillary is nothing but a blood vessel. Now here is the plasma present. Now the plasma have to cross this capillary. Now this plasma, whatever is there in the glomerular capillary, have to cross that capillary and it have to enter into the Bowman's capsule. So it have to cross a layer called as filtration barrier. Okay, now we'll discuss in detail about the filtration barrier. Guys, here I am showing you, this is the glomerular capillary. This is the glomerular capillary. Okay, now say this glomerular capillary, here is the blood. Okay, here will be the plasma, RBC, WBC, platelets, everything will be here. Now I am showing you, okay, I am going to show you the magnified view. See, this is the magnified view of this glomerular capillary. This is the magnified view. Now in this magnified view, please see this glomerular capillary. Okay, this glomerular capillary, see how many layers are there? There is this one endothelial layer. Okay, there is capillary endothelium, the innermost layer. Here is the capillary endothelium. So endothelial layer is there. Now endothelium is lying on what? Endothelium is lying on the basement membrane. See, here is the glomerular basement membrane. Okay, so imagine this is the glomerular capillary. Now this glomerular here is the plasma. Okay, here is the plasma. This plasma have to cross this barrier. This barrier is the glomerular filtration barrier. Now this glomerular filtration barrier is made out of, see, capillary endothelium, basement membrane, and outside there are the cells called as podocytes. Okay, podocytes. You can ask me, what are these podocytes? Podocytes are the epithelial cells in the Bowman's capsule. Okay, let me show you here. See, in the Bowman's capsule, even the Bowman's capsule is lined by the, epithelial cells. So now these epithelial cells are mainly divided into two types. Okay, these epithelial cells are divided into two types. One is the parietal layer. Okay, this is the parietal layer, and the epithelial cells which are now coming and attaching here, they are called as the visceral layer. Okay, now this visceral layer, they are called as the podocytes. Now this visceral layer, see, podocytes of visceral layer. So here you will be having podocytes. Okay, now on the outermost layer, imagine this is the capillary. Now this capillary, inside there is endothelial layer. Okay, inside there is endothelial layer. Now this endothelium is sitting on the basement membrane. Now outside the basement membrane, you are having which cells? Now the visceral epithelial cells of the Bowman's capsule, which are called as podocytes. Podocytes are present outside. So the same thing. So here it is a capillary endothelium, basement membrane. Now down to it, please appreciate these cells which I am showing you. These cells in light color. Okay, light color. Now these cells are called as the podocytes. See, podocyte food processes. These are the podocytic cells which have this podocytic food processes. Okay. Now tell me, so the filtration barrier, it is made up of how many structures? The filtration barrier is made up of 3 structures. Now the plasma have to cross these 3 structures, okay, in order to enter into the Bowman's capsule. So the filtration barrier is made up of 3 structures. What are they? Capillary endothelium, glomerular basement membrane, and podocytic food processes. Okay, now the plasma or any substance have to cross these 3 layers. For example, think like this. If a substance is big, okay, big substance, high molecular weight, big size substance is there. Now, do you think such a substance is going to cross this? No, definitely not. So, what we are going to discuss here is this filtration barrier. This filtration barrier only allows small size substances to be filtered. Okay, it allows only small size substances to pass through. Now, in order to understand that, okay, even before understanding that, we need to know few more important basic points. What are they? See, look at this endothelial layer. Okay, look at this endothelial layer. Now, this endothelial layer, are you able to appreciate the small gaps? So, these gaps which are present in the endothelial cells, even these endothelial cells have small gaps. Now, these gaps are called as a fenestrae or fenestrations. So, fenestrations are the gaps in endothelial layer. Okay, now why are these gaps? Why? Because now the fluid is going to pass through these gaps. Substances, okay, glucose, amino acids, they will, they will pass through these gaps. So these are called as the fenestrations. So there are gaps in endothelial layer. Okay, now basement membrane is almost leaky. Okay, basement membrane is like, it's nothing but a collagen, it's almost leaky. Okay, now down to it, which cells are there? There are these podocytes. Podocytes are there. Now even there is spaces, okay, even there are gaps between podocytes. See here, even there is a gap between podocytes. So these gaps which are present between the podocytes are called as slit pores. Okay, slit pores. So filtration slits or slit pores are the gaps between the podocytes. Now tell me, what are the 3 layers? Capillary endothelium, glomerular basement membrane. Down to it there are podocytic food processes. 3 layers are there. Now these 3 layers together called as filtration barrier. So what is the importance of this filtration barrier? This filtration barrier doesn't allow RBC, WBC, platelets, plasma proteins. All the substances are not going to be filtered. Only plasma will be filtered. Only small size substances will be filtered. Okay, so substance with a big molecular weight or big size is not going to be filtered. Okay, so size of particles which are freely filtered. Okay, usually a particle size of 4 to 8 nanometers. Okay, 4 to 8 nanometers. Okay, 4 to 8 nanometers is freely filtered. Okay, and what are the gaps between the endothelial capillaries? The gaps between the endothelial capillaries are called as fenestrations, and gaps between the podocytes. Okay, these gaps between the podocytes are called as slit pores. Okay, now here itself, I want you to know this one point. See, the gaps between these podocytes, these gaps are called as filtration slits, okay, or slit pores, okay. Now, please appreciate there are important proteins. Okay, there are some important linker molecules or proteins which are present in these gaps. Okay. Now, are they acting like a barrier or not? Yes, they are also acting like a barrier for the movement of the substances. Substance have to move from here. This is the lumen. From here, the substance have to cross the endothelium. Substance have to cross the basement membrane. Now, it have to pass through this gap. Now, in the gap, a lot of important proteins are there, like podocin, nephrin, alpha-actin 4. Important proteins are there. Now, even they will also act as a barrier. For example, now, if there is any damage to this area, or I can directly say, sir, these proteins which are present over here, these proteins, they will form something called as a slit diaphragm. In between the podocytes, there are these gaps present. In these gaps, there is a structure called as, in these gaps, there are a lot of proteins. All those proteins together forms a structure called as slit diaphragm. In the slit pore, there is a diaphragm present. Okay, there is a diaphragm present. Now, if there is any damage to the diaphragm, what happens? Okay, if there is any damage to one of these proteins, what happens? Slit diaphragm is affected. If slit diaphragm is affected, now big size substances are even filtered. Big size substances are even filtered. Okay, that will cause us proteinuria. Even the proteins, okay, proteins, now they will be filtered away. Why? Because here is it's like a diaphragm. It's like a diaphragm. It's a obstruction. It's a barrier. It doesn't allow the big size substances to filter. For example, once if it is damaged, means that will cause proteinuria or nephrotic syndrome, loss of proteins in the urine. Loss of more than 3.5 grams of protein per 24 hours is called as a nephrotic syndrome that can occur. So damage to slit diaphragm can lead to nephrotic syndromes. Okay. Now after this, let's come back, guys. Let's discuss about the glomerular filtration. Yes, we are discussing about the glomerular filtration. In that, we are saying that glomerular filtration barrier, this filtration barrier, this glomerular filtration barrier is a size barrier. Why it is a size barrier? Why? Because it only small size substances to be filtered. Okay, it allows only 4 to 8 nanometer substances to be filtered. If a size of a substance is more than 8 nanometer, it is not going to be filtered. It's not filtered. Okay. Now, not only that, this GFB, okay, glomerular filtration barrier. This glomerular filtration barrier is also a charge barrier. Okay, it's a charge barrier, which means it allows positive charge substances to be filtered, or negative, it allows positive charge substances to be filtered and neutral charge substances to be filtered, but it doesn't allow negative charge substances to filter. This glomerular filtration barrier, see again I am repeating, this glomerular filtration barrier, it doesn't allow negative charge substances for the filtration. So negatively charged substances are not filtered. Now you can get it out. Why negative charge substances are not getting filtered? Why? Because see, look at here, guys. Now this glomerular filtration barrier, okay, this filtration barrier. Now this filtration barrier by itself is having negative charge. Okay, this glomerular filtration barrier. Now it have which charge? It have the negative charge. Now tell me, here is a negatively charged substance. For example, here is a negatively charged substances like plasma proteins. Now these plasma proteins, okay, the plasma protein which I am taking an example, okay, this plasma protein is an albumin. Okay, now the plasma protein which I am taking for the example is albumin. See, albumin is a very small molecule. Okay, I shouldn't even like draw this much big molecules. Okay, albumin is a very small molecule. Okay, it's a very small molecule, very small plasma protein. Now, yes, it can be easily filtered. Okay, it can be easily filtered. It's like almost 4 nanometers in size. Okay, the size of the particle, albumin. Now, it can be easily filtered, but still, no proteins are seen in your urine. No albumin is seen in your urine. Why? Because though it is small in size, yes, it can pass through the fenestrations and it can pass through the slit pores, but still it is not filtered. Why? Why? Because this glomerular filtration barrier, okay, this glomerular filtration barrier is having negative charge. Albumin or plasma proteins, they are also having negative charge. So this negative charge will repel the albumin. So when the negative charge is repelling the albumin, albumins are not going to be filtered. So no proteinuria is seen or no albuminuria is seen. Okay. So now tell me, does the negative charge substances are going to be filtered? No, negative charge substances are not filtered. But if for example think there is this one substance which is having a positive charge. Now let's take a substance which is having a positive charge. Now what happened to the substance, positive charge substances, when compared to the neutral charge substances? Okay, when compared to the neutral charge substances, these positive charge substances are more readily filtered. Why? Because the negative charge will attract the positive charge. Okay, so that's a very important point. So now tell me, which substances are more filtered? Positive charge substances. Okay, positive charge substances filtered more easily than neutral. Okay, and neutral charge substances are more easily filtered than negative charge. And even, yes, first of all, negative charge substances, okay, they don't even filter. Okay, so positive charge substances are easily filtered when compared to the neutral charge substances, and negative charge substances are not going to be filtered because the glomerular basement membrane by itself is having the negative charge. Question is, why it is having this negative charge? The negative charge of glomerular basement membrane is because of presence of heparan sulfate. Okay, presence of the heparan sulfate, glycoproteins and sialoproteins. So because of these substances are present in the glomerular filtration barrier. Okay, these are the integral part. They are the integral part of the glomerular filtration barrier. Okay, so these substances are first of all negatively charged substances. So because these substances are negatively charged substances, even glomerular basement membrane is having the negativity. So negativity will repel the negativity. So tell me guys, the glomerular basement membrane is having which charge? Negative charge. And the negative charge is because of heparan sulfate, sialoproteins and glycoproteins. Okay, now look at here, glomerular basement membrane is not only a size barrier, okay, not only a size barrier, but it is also charge barrier. Why it is called as a charge barrier? Because negative charge substances are not filtered. Okay, negatively charged substances are not filtered. Not only that, see, in glomerulus, RBC is going to be filtered? No, see, the substances which are not filtered, yes, RBC is not filtered, WBC is not filtered, platelets are not filtered, your plasma proteins like albumin, globulin, fibrinogen, okay, all these are not going to be filtered. Plasma proteins are not filtered. Even albumin, the smallest protein, albumin, though it is of small size, why it is not getting filtered? Because, see, albumin small in size, but it is negatively charged. As it's a negatively charged, it's not going to be filtered, it will be repelled away. So, does not filtered. And all your clotting factors, okay, 12 clotting factors are there, no? Okay, so all these clotting factors, component proteins, nothing is going to be filtered, nothing is going to be filtered, and no proteins will be seen in the urine. Okay, these are the basic concepts which I want you to know. Now, my question is, if someone comes to you and asks you, RBC is not filtered, okay, but what about the glucose molecules and amino acid molecules? Does this glucose molecules and amino acid molecules, do they filter? Okay, do they filter in Bowman's capsule? Do they filter into the Bowman's capsule? Yes, they do filter. So, amino acids are freely, freely filtered. Even glucose is freely filtered. But don't think that these molecules are going to come out in the urine. They are not going to come out in the urine. Rather, they will be reabsorbed back. 100% of the glucose will be reabsorbed back, and 100% of the amino acids are reabsorbed back. So, glucose and amino acid molecules are freely filtered, but they are 100% reabsorbed in the PCT. Why? Because they are high threshold molecules. Okay, they are high energy molecules. They will be reabsorbed back. Now, after this, let's discuss some important points about the slit diaphragm. Okay, now let's discuss important points about the slit diaphragm. See here, I am showing you the glomerular filtration barrier. Okay, the glomerular filtration barrier. Okay, so in the glomerular filtration barrier, how many layers are there? We know 3 structures are present. See, this is the lumen, capillary lumen. Here is the plasma, RBC, WBC, platelets, everything are here in the lumen. Outside, this is the Bowman's capsule. Take this as a Bowman's capsule. Okay, outside is the Bowman capsule. Here inside, this is the capillary lumen. Now, what is this structure? This structure which I am showing you here, this is the filtration barrier. So, fluid have to move from here to Bowman's capsule. Fluid have to cross these 3 layers. What is the layer number 1? This layer number 1 is called as the endothelial layer. We know this endothelial layer is having gaps. See, the endothelial layer is having gaps. Now, these gaps are called as fenestrations. They are called as the fenestrations. Now, all these endothelial cells, they are sitting on the glomerular basement membrane. Okay, glomerular basement membrane. Now, outside the glomerular basement membrane, you are having the cells which are called as the podocytes. These are the visceral cells in the Bowman's capsule, visceral epithelial cells in the Bowman's capsule, which are called as podocytes. From beginning, I am asking you to remember the space between the podocytes. The space between the podocytes are called as slit pores, and in the slit pores, there are some important proteins present which forms the slit diaphragm. Even here, please appreciate, there is this line, right? Okay, this line is representing the slit diaphragm. So, slit diaphragm is present between podocytic foot processes. Okay, now this is slit diaphragm. Let's talk about the slit diaphragm. The slit diaphragm is made up of, okay, this slit diaphragm is made up of some important components, okay, some important proteins which are like podosin, nephrin, okay, podosin, nephrin, alpha actinin 4. So, podosin, nephrin, alpha actinin 4, all these are the important substances which are forming the slit diaphragm. Okay, now let's discuss about some important pathological correlations. Okay, now for example, if there is any defect in the nephrin, okay, if there is any defect in the nephrin, automatically slit diaphragm will be affected. Once the slit diaphragm is affected, means proteins are going to lost in the urine, that causes nephrotic syndrome. Okay, nephrotic syndrome. So, nephrin defect. Okay, nephrin defect. First of all, why this nephrin might be defect? It's a protein, right? So, definitely it should be having a gene. So, what is the gene coding the nephrin? So, this nephrin is coded by a gene called as NPHS1. So, this NPHS1 codes for nephrin. Okay, so the mutation of this NPHS1, nephrin is affected in the slit diaphragm. When the nephrin is affected, it is going to cause a disease called as congenital nephrotic syndrome of Finnish type. Okay, so congenital nephrotic syndrome of Finnish type is due to mutation in NPHS1, and what is the protein affected? The protein affected is nephrin. Okay, now such type of nephrotic syndrome is easily treated with the steroids. So this variant of the nephrotic syndrome, there are many nephrotic syndromes, guys. Okay, minimal change disease, focal segmental glomerulosclerosis, membranous glomerulopathy. Okay, there are different types are there. But anyway, this congenital nephrotic syndrome of Finnish type, yes, it is easily treated with the steroids. Okay, now after this, let's discuss about the podosin. Podocin is also one of the important protein in the slit diaphragm. Now, podocin is coded by NPHS2. Okay, it's coded by a gene called as NPHS2, and mutation of this NPHS2 will cause damage to the podocin or defect in the podocin. So, when defect in the podocin means defect in the slit diaphragm, that causes again protein loss in the urine, nephrotic syndrome. Which type of nephrotic syndrome? See, this is steroid resistance. The above one is steroid sensitive. Now, you are going to have a nephrotic syndrome which is steroid resistant. So, steroid resistant nephrotic syndrome of childhood onset. So, steroid resistant nephrotic syndrome of childhood onset is due to podocin defect. Okay, it's due to podocin defect. Now, let's talk about some other conditions. This alpha actinin 4. Now, let's talk about the alpha actinin 4. See, this alpha actinin 4, okay, it's also very important component. Okay, it's also very important component of the slit diaphragm. So, mutation in the gene encoding for alpha actinin 4, if the gene, okay, if it is affected, okay, the gene coding for the alpha actinin 4 is affected, means what will cause this? Again, it will cause damage to the slit diaphragm, proteinuria, nephrotic syndrome. But which type of nephrotic syndrome? Now it is called as AD-FSGS. Okay, autosomal dominant. Okay, autosomal dominant focal segmental glomerular sclerosis. It's also a type of nephrotic syndrome. Okay, so nephrotic syndrome, it have like, it's like a spectrum of disorders. Like, lots of disorders are there under it. Okay, nephrotic syndrome means loss of proteins in the urine. If the patient is losing lots and lots of proteins in the urine, more than 3.5 grams of protein per day, then it is called as a nephrotic syndrome. There are different causes for the nephrotic syndrome. Okay, there are different diseases where proteins are losing. So you can say, yeah, they are all coming under nephrotic range proteinuria. Now, alpha actinin 4, if it is mutated, means alpha actinin 4, if it is mutated, means it is going to again cause a nephrotic syndrome which is called as autosomal dominant focal segmental glomerular sclerosis. Focal segmental glomerular sclerosis. And also there is one more important structure in the slit diaphragm which is called as TRPC6. Okay, TRP C6 channels. Now this TRPC6 channels are also affected, means that will also called a type of nephrotic syndrome which is called as adult onset. Okay, adult onset FSGS. So adult onset FSGS is a type of nephrotic syndrome due to defect in the slit diaphragm. Which defect? TRPC6 mutation. TRPC6 mutation. Now after this, let's discuss about why exactly filtration happens. Okay, now the entire topic is this, right? Glomerular filtration. Okay, why exactly filtration is happening? See, yes, blood is coming like this, plasma is coming like this. Now this plasma is going into the glomerular capillaries. Okay, don't think that there are these gaps, are just filtration is not happening because of the gaps. Okay, gaps like the fenestrations and the slit pores, they do permit, okay, they do permit the filtration of fluid, but why exactly the fluid is moving from the glomerular capillaries into the Bowman's capsule? Who is actually, what is the actual driving force? Now, to understand that, you need to know two important pressures. Okay, you need to know two important pressures. They are hydrostatic pressure. Now let me show you one capillary. Now let's take this as one capillary, example of a capillary. Now in this capillary, yes, fluid is there, plasma is there. Okay, now this plasma, see, all the time this plasma want to move out. Okay, the plasma is willing to move out. Okay, the plasma is exerting pressure on the capillary. Okay, the plasma is exerting pressure on the capillary. So this pressure exerted by the plasma to move out, this pressure is called as hydrostatic pressure. Okay, hydrostatic pressure. Okay, hydrostatic pressure. Not only that, in the capillary there are these important substances present. Now these important substances which are present in the capillary are called as plasma proteins. Now these plasma proteins, mainly it's albumin. Okay, the most important plasma protein in this topic is the albumin. Now what this albumin is doing? Albumin, try to remember, it's like a sponge piece. Okay, albumin, remember it like a sponge piece. Okay, now what sponge piece will do? When you dip a sponge into the water, what it will do? It will immediately absorb the water. So sponge pieces all the time keeps the water with themselves. Okay, they attract the water, they keep the water with themselves. In the same way, this albumin molecule is also osmotically active. Okay, it's osmotically active. It all the time keep the water with itself. Okay, it holds the water. So now what it is doing is it allowing now this albumin osmotic pressure because of this albumin. Now this pressure because of the albumin is called as osmotic pressure. Now osmotic pressure is favoring the filtration or it's against the filtration? It's against the filtration. It's an opposing force, right? See, hydrostatic pressure, what it is doing? Hydrostatic pressure is trying to push the fluid from the capillary into the Bowman's capsule. Okay, it's trying to move the fluid from the capillary into the Bowman's capsule. What this albumin is doing? Albumin is trying to keep the fluid. Okay, albumin is just like a sponge piece. It's all the time trying to keep the fluid within the blood vessel. Okay, this pressure is called as osmotic pressure. So hydrostatic pressure is a favoring force. Hydrostatic pressure is a favoring force for filtration. Now this osmotic pressure, okay, colloidal osmotic pressure, because of the albumin, it's a opposing force. It doesn't allow the filtration to happen. Okay, so this hydrostatic pressure and osmotic pressure, these forces are called as Starling laws of forces. Okay, they are called as the Starling's laws of forces. Now let's see why exactly filtration happens. What are the favoring forces and what are the opposing forces? Okay, now see here guys, Starling forces. Now whether the filtration happens or not, it depends on net filtration pressure. Net filtration pressure. So what is this net filtration pressure? Favoring forces. Okay, favoring forces and opposing forces. Favoring forces and opposing forces. Now what are the favoring forces? First let's discuss. The favoring forces are those forces which are trying to move the plasma from the capillary into the Bowman's capsule. Okay, so what are the favoring forces? Favoring force is the hydrostatic pressure. We have seen hydrostatic pressure wants to move the fluid from the capillary into the Bowman's capsule. So PC, I am just showing you the PC. It's the hydrostatic pressure in the glomerular capillary. Hydrostatic pressure in the glomerular capillary. Okay, done. It's a favoring force. Okay, sir, done. One favoring force. Now what are the opposing forces? Opposing forces include the osmotic pressure. Okay, it is pi C. Let's show it like pi. Okay, let's give the word pi. Pi C. Pi C means the osmotic pressure in the capillary. Osmotic pressure in the glomerular capillary. Now what is the hydrostatic pressure? If you ask me the value, the hydrostatic pressure is 60 mmHg. Okay, it's 60 mmHg. Now what is the osmotic pressure in the capillary? The osmotic pressure in the capillary is 32 mmHg. Okay, now what is the hydrostatic pressure in the Bowman's capsule? Now look at here guys, see the fluid in the capillaries. Look at the fluid in the capillaries, it all the time want to come into the Bowman's capsule. It all the time want to come into the Bowman's capsule. But also remember, even in Bowman's capsule some fluid is there. Okay, now even in Bowman's capsule some fluid is there. Now this fluid, what it will do? Now the fluid which is present in the Bowman's capsule, now it will act against the filtration. Why? Why? Because see, even here in the Bowman's capsule, fluid is there. So this fluid will also have hydrostatic pressure. The fluid in the Bowman's capsule also have hydrostatic pressure. But this is hydrostatic pressure in the Bowman's capsule. Hydrostatic pressure in the capillaries want to push the fluid into the Bowman's capsule. But here hydrostatic pressure is there. No, now this hydrostatic pressure, it is exerting opposite pressure. Okay, it is giving opposite force. So it's preventing the filtration. It gives the opposite force. Or simply try to understand like this in a layman's term, in a simple way. So the fluid in the capillaries want to come down. That's a favoring force. Now the fluid in the Bowman's capsule, now it want to go in. Okay, it's creating opposite. Like here fluid is there, right? Yes. Now this fluid is going to show the pressure on these walls or not? Yes, the fluid is going to exert pressure on these capillary walls. So now what happens? It will create a negative force for the filtration. It will create an opposing force. Now it is acting like an opposing force for the filtration. So what are the two important opposing forces? The two important opposing forces are one in the capillary, that is the osmotic pressure because of the albumin. The other is hydrostatic pressure in the Bowman's capsule. Okay, hydrostatic pressure in the Bowman's capsule. Now tell me, what are the favoring forces? Favoring forces are 60 mmHg. Okay, favoring force is 60 mmHg. What are the opposing forces? The two important opposing forces, one is the colloidal osmotic pressure because of the albumin, that is 32 mmHg, and hydrostatic pressure. Hydrostatic pressure in the Bowman's capsule, that is how much? It is 18 mmHg. 18 mmHg. So now add the favoring forces. Favoring forces are 60 mmHg. What are the opposing forces? Opposing forces are 50 mmHg. So who is more? Favoring forces of filtration are more. By how much percent? 10%. Like not even 10%, by 10 mmHg. Okay, so what is the net filtration pressure? We know net filtration pressure is equal to favoring forces minus opposing forces. What is the favoring force? 60 hydrostatic pressure minus what is opposing force? Opposing force is 50. That is the osmotic pressure with hydrostatic pressure in the Bowman's capsule. That is 32 plus 18, 50. So 60 minus 50 is 10 mmHg. So glomerular filtration is happening with a pressure difference of how much? With a pressure gradient of 10 mmHg. Okay, that's favoring the filtration. That's favoring the filtration. And we know what is the normal glomerular filtration rate. The normal glomerular filtration rate is 125 ml per minute. So how to calculate it? How to calculate it? So the gold standard agent or the marker to calculate the GFR is inulin. So by looking at the inulin, okay, you have to inject the inulin and you have to see the urinary concentration of inulin, you have to look at the plasma concentration of inulin. So there is a formula to calculate the GFR. In the next slide we will see that. So the important agent, the gold standard agent for GFR estimation is inulin. Not only that, not only inulin, even creatinine, even creatinine and cystatin C, these are also the markers, these are also the markers of filtration, these are also the markers of filtration. So inulin is the marker of GFR, creatinine is a marker of GFR, and cystatin is also the new marker of GFR. Now after this, let's discuss about how to calculate the glomerular filtration rate. How to calculate the glomerular filtration rate. Now we will see here. See, in your exam, whenever you see something like how to calculate the GFR, they are asking you, so calculate the GFR, they will give you a question and they will ask you to calculate the GFR, or even they can mention something like how to know the clearance of a particular substance. So for the clearance, same formula, for the GFR also same formula. Now what is the formula if you ask me? See, GFR or clearance, same formula for the GFR calculation as well as for the clearance also, it's the same formula. What is the formula? GFR or clearance is equal to UV by P. So GFR or clearance is equal to UV by P. So what is this U? If you ask me what is this U, it's a urinary concentration of that particular substance. In the question they will give you, what is the urinary concentration? And V means how much volume of urine produced. What is the amount of urine produced? 2 ml, 3 ml, 10 ml, 20 ml, like something like that. So amount of urine produced. And what is this P? It is a plasma concentration of that particular substance. It's a plasma concentration. So what we are checking? We are checking the urinary concentration of a substance, and we are checking the plasma concentration of a substance, and also we are checking the volume of urine produced. So UV by P is the formula for GFR calculation as well as for the clearance. So with this, we are done with the topic of GFR, glomerular filtration, and how exactly the glomerular filtration occurs. And also we have seen the formula of GFR. Okay guys, the video is completed. Hope the video is helpful. Thank you.